Welcome to Coronavirus Your Stories, a programme about how COVID-19 is changing lives around the world. I'm Philippa Thomas, and this week we're looking at nature and climate, how our natural environment can help us as individuals in times like this, and also the personal story of two activists who want the global pandemic to throw more light on the global climate emergency. Later, we'll hear from Ireland about one way of turning to nature in stressful times, with growing interest in the traditional practices of forest medicine, like forest bathing. And from Sweden, how health-based architecture can help us now to redesign the spaces around us, try to stay healthy and be more resilient to infection. Next, getting out into nature and bringing nature home to us. How to link the great outdoors with our personal health and peace of mind. From Sweden, the man seen by many as the godfather of health-based architecture, Professor Roger Ulrich, about what that means and how it can help us right now. And from Ireland, the founder of the Forest Therapy Institute, nature and wellbeing consultant Shirley Gleeson.
Forest bathing, the concept came from Japan in the 1980s. So you're really engaging your five senses in the natural environment. So you're listening to the bird song, to the natural sounds of the forest. You're smelling the different aromas, maybe from the forest floor. You are walking mindfully in nature and slowing down. You're watching what's moving. So you're taking in the environment with all your five senses. So it's really mindfulness in nature. Engaging them through nature immersive experiences and getting them to slow down and reflect.
Roger, we've always known, I suppose, that a walk in the woods is good for us. What does scientific evidence tell us about exposure to nature?
Exposure to nature, even viewing nature, even in a realistic nature video accompanied by nature sounds, can quite quickly produce significant reduction of stress.
Shirley, the kind of effects Roger is talking about, do you see that when you're out in the forest with people who've come to you for therapy?
Yes, we would see that all the time in the forest. People would report feeling calmer. Their fast thoughts in their head would really reduce. They would slow down. When people couldn't leave their homes, we were running a number of nature and wellbeing sessions online. So we would bring nature to them. Like Roger said, you know, the evidence base around viewing nature scenes or hearing nature recordings is quite strong. So even when people can't leave their homes, it's still possible to have a forest bathing experience. But also if you think about people in hospitals, people in nursing homes, people in prisons that never or rarely get access to nature, that's where you can bring nature into them to help promote their well-being.
Have you had more demand, Shirley, because of the COVID pandemic and the effect on us all?
Yes, there's been a huge demand because of the pandemic, because there's huge increase in stress and anxiety that people are experiencing. There's so much uncertainty around. But also what we found is that now people have had a period of time, maybe out of the workforce for a little while. They've reconnected with their nearby nature, so nature on their doorstep. So they're really seeing the value and importance of the nature that surrounds them.
And Roger, you were telling us about the evidence you've gathered, and you published the groundbreaking paper back in 1984 showing the impact of healthcare environments, both for patients and for medical staff. Are you seeing that now?
I published a study which found that if hospital patients recovering from abdominal surgery and who spent at the time about a week in the hospital after surgery were more or less randomly assigned to rooms with bedside window views of nature, trees in this case, they had significantly better post-operative recoveries than equivalent matched patients assigned more or less randomly to the same types of room with the same staff, except they had bedside window views of a brick wall for their week. Those with the nature view had lower levels of emotional distress. They experienced significantly less pain.
If I can pick up on that, if you fast forward to today and the COVID crisis, and so many of us thinking about hospital or the possibility of hospital, are you seeing the environment in clinical settings make a difference, do you think, to COVID patients, to their recovery?
I know of no study yet published, quality study, that's examined the effects of nature on patients who are hospitalized or homebound with COVID. Probably it's a matter of time. Probably such studies are in progress. I do think, however, that we have some good research quite pertinent to COVID and staff stress. So I think it's noteworthy that a study published a few months before coronavirus hit showed that if nurses were assigned to take a daily break for about 25 minutes a day over 6 work weeks, in contrast to being assigned randomly to take an equivalent break in a very attractive indoor break room, those with the break in the garden had evidenced significantly, really substantially reduced burnout, and that's good news.
Following on from what Roger has been saying in terms of burnout, that is a real concern, from a mental health and physical health perspective. I've had contact with a number of health professionals that are experiencing extreme burnout. They don't know how they're going to manage. We need to look at alternatives to what is currently there in terms of the current health system. And I think that's where the work in nature comes in, like forest bathing, forest therapy, ecotherapy, because that provides an alternative to the current health service offering. We're not saying it's better. We're not saying it's better at all, but it is an adjunctive to current treatment. And I think that's what's going to be needed. Is there's going to be investment needed in nature-based interventions in green care to look at innovative solutions for mental health.
Shirley, we focus a lot in this programme on personal stories, and I think you heard from was it a nurse or a clinical practitioner in Denmark?
That's right. So one of our trainers has run some interventions in Denmark, and a nurse who worked in cardiology in Denmark was experiencing work-related stress and difficulty sleeping. So what she said was after the 6-week forest therapy intervention, her sleep had really improved. She could gain greater clarity and perspective into her situation, and the stress symptoms had really reduced.
The green outdoors or nature is a resource. We don't have equal access to it. In many countries or areas, there is no great green outdoors. Roger, I know as you're looking at architecture and you're looking at public health, and that's a concern, isn't it? This unequal access.
Unequal access, yes. I'm American born. My wife is Swedish, and it's no accident that we targeted an area of Sweden to live in and retire in some years ago. Here, nature is ubiquitous in cities, even in larger cities. And regarding the equity question, anyone, you don't have to be wealthy to have access to nature or even a forest. So I think this is really an urban planning issue. It's a political issue. And clearly, in many countries, we need a lot more green space.
Roger Ulrich in Stockholm and Shirley Gleeson in Dublin, ending this week's edition on COVID, climate and nature. I'm Philippa Thomas. Thank you for watching Coronavirus, Your Stories.